Hi guys. So I'm Lindy Turner. I just want to tell you a little bit about me and then we're going to hop off into the training and then afterwards I'll stop the recording and we can answer any quick questions and then follow-up questions. Write those down. We're going to have a big Q&A session with the whole team that put together the provider program. But a little background about me. I am a nurse. I've been a nurse for almost 2 decades. I have been critically care trained. I did ICU and ER for years. And then I moved into administration and worked directly with a lot of provider type services, medical staff, things like that. Cassie, who's on today, was actually my boss. She was the VP of quality and I was the quality director. And so we did a lot of work with providers. And what I love about what we have with 3 is that this is so easily moved from just being a network marketing thing that we are here doing, all of us on this call, to being able to be something that is offered in a clinic setting, in a gym setting, in all kinds of settings so that we can reach a lot more people. So drop it in the chat if you have seen at your chiropractor, at your clinic, at your gym, they have display of some sort of product, right? Like maybe you go and you get an esthetician, like if you're getting Botox and they have a product line. This is super common in retail spaces. It is literally unheard of for a retail space not to have some sort of product line. So our goal with this program was to bring 3 to those spaces so that we could have an easy, streamlined approach to allow those providers, we blanketed the term providers to encompass all of those people that are providing products to the marketplace, to have the ability to have something that they didn't have to create themselves, that was created for them, that helped them launch this into their places. And for you on this call, to help you attract those individuals with a very high quality program that is turnkey and streamlined. So huge shout out to the entire team, from Mike Hollis to Dottie V, to Lisa, to Francoise, to Hillary and Colleen, to like all of the people that were involved in making this, because this is like a work of love. And if you were on that team, drop it in the chat because you'll need a huge shout out. Okay, so I'm going to drop the boards one more time. Make sure that you have access to this in some way, shape, or form, whether you have to go off and like put it off to the side and use it on your phone, or you are on your computer and you have your phone right next to you. We're going to work through this together because I want to give you kind of the tools to use this program to your benefit. Okay. You don't have to be, a doctor to be able to use this. So what is the program? Like I said, it is to help providers launch the product line in their location. And the program is to help those of us who are brand ambassadors not only attract and recruit providers, but to help them seamlessly launch that in their location. So who is this for? Well, just like we talked about, it's for providers such as physicians, nurse practitioners, physician's assistants, those type of people that have their own clinic space. It's for clinicians, but also for people that are like estheticians that maybe run a med spa, that have injectables, or gym owners, or hair salons. Even hair salons are utilizing this. If Stephanie Stewart's on the call, she is utilizing this program in her hair salon. So there is a wide array of people. I don't want you to pigeonhole yourself into thinking that this is just for physicians. We agree? Okay. Why do we want to do this? We attract a lot of providers on this team. I think we're close to 1,000 physicians. And this doesn't include like nurses, nurse practitioners, all those other types of people that are in the medical space. Whatever we're doing, we attract a lot of medical professionals and people that have clinic locations. So we want to give this to them because it will help them launch in their platform, but also because what's our goal here at 3? To get our products in the hands of as many people as humanly possible. We agree? Drop a 1 in the chat if you agree, because amen, that's the point. So our goal is to help these people get into their locations, get the products out to their clients, and get people all over our country talking about it. Okay, so how do we do that? There's 3 basic processes, okay? Number 1, you got to find them. Number 2, you got to recruit them. Okay. And I don't really like the word recruit. I like the word sponsor. Like you got to find them and love on them and get them to see what the benefit is here and then sponsor them in this business. And then 3, we're going to launch them. So first, find. I was having a great conversation with a super rock star down in Miami yesterday, Miss Danielle, because she is launching some pretty fantastic things with using the provider program. And my question to her was, how did you find these people? Because most of us think, oh, I got to go like door to door. I need to go talk to my chiropractor or whomever, right? But I want you to realize that number one, the first way to find them is in your network. Tampa, I'm sorry. You're somewhere in Florida. So in your network, you already know those types of people that we talked about. So your number one homework for today is to write on your list. You should already have your list because we're all professionals. Find your list, get it, and write in provider program options or provider program people. Who do I want to reach out to that potentially have some sort of location that they could launch this? Who do I know that has a hair salon, that has a online retail space? One of my nurse practitioners knows a supplement company. One of her friends owns a supplement company, and he utilizes the best of the best supplements and sells them to the public. Guys, the best of the best, 3 should be right there, like front and center. Okay. So who do you know that has some sort of retail location? That's number one, your network. Number 2 is going to be your network's network. So in Danielle's situation, she knew one of the providers that she's currently launching. She has 4 that she's currently launching, and one has like multiple locations. Out of those 4, she only knew one. It was her chiropractor. So who do you know that your direct, like you know them, and then go forward? Her chiropractor knew someone who is joined and is launching. And then another friend of hers knew someone who knew someone that owned a gym who has multiple locations. So there's all different ways. Remember, I think it's like 6 degrees of separation from every single person in the world. It's a great idea or thought that you really do know a lot of people. Okay, so your network's network. The third is your community. Who do you know in your community that has retail space? That maybe they're not necessarily your network. You're not like, you don't know them. They're not your bestie. They're not your friends, but you know of them or you have interacted with them. Maybe they're, a provider that you've worked with, or they're your kid's pediatrician, those types of people. I will say caveat, a lot of times if you are talking with physicians, remember that modern medicine and all allopathic medicine, like those kind of things, don't mesh always. And if they utilize insurance, government, like Medicare, Medicaid, they are limited. They don't always have the option to put things in their locations. It doesn't mean you should share with them. That doesn't mean you shouldn't share with them 3, but it does mean that they are limited in a lot of aspects. So for me, I know a lot of hospital doctors, ICU doctors, ER doctors, specialists that work in the hospital. Well, they are hired, they're employed by the hospital. So they don't have the ability, they don't have their own location like a Dr. Schneider who owns his practice. Do y'all see the difference? So remember, if you're reaching out to people, there may be different circumstances based on how the provider works, how they're employed, if they own their own company, if they own their own business, that sort of thing. And then the 4th way is your online community. Anyone else have online, or is it just me? Because I love me some social media. Okay, who do you know in your social media network that has a location, that has or knows people that do? I probably have, at this point, hundreds, if not thousands of nurses that have followed me over the years. They probably know providers, right? So maybe you reach that type of person through that network. There's also places like LinkedIn, Instagram, where you can reach out. I am not a fan of cold market, but if that's the option, and work with your upline, to determine how to reach out to those people best. Okay, so we're good on finding them. Any questions on that, drop it in the chat. The next step is, how do we actually recruit them? Like, what do I say? What do I do? I'm terrified. Anybody else feel terrified sometimes when they're talking to a medical professional? Okay, good. Everyone feels like that. You are not alone. So remember, hey, I'm not alone. I'm going to turn this nervousness into excitement because it's the exact same reaction in my body, and I can tell my brain that. So we're going to be excited. And if they say no, it's okay. There's a whole bunch of fish in the sea, right? So here's the recruitment. What is the goal for most providers, whether it's a med spa to a physician to even a salon? Most of them will tell you they want to provide great care, the best care possible for their clients and patients, and they want to make income. Okay? We have both those things in a little package for them. So the next step is really the invitation. Once you've developed a relationship with whomever it is that's on that list that we talked about, is inviting them to take a look. Now, open up your handy dandy boards, and I'm going to try to share my screen because I want you guys to see this. On boards, we're going to go down to 3 info. All of you guys should have access to this. This is the UCrew boards, okay? Now, they have done some amazing things when we developed this program. We put in some special invitations that hopefully will help you guys with reaching out and inviting to providers. So where are they? They're under UCrew Nation Playbook, which is kind of like our holy grail. If you want to know how to do the business, this is your playbook. And under contact and invite scripts, you're going to see all kinds of options. Drop a 1 in the chat if this is the first time you're seeing this. Drop a 2 if this is your you love this place, because I get so many ideas from this little section. Now, under text scripts, we have a ton of options. You're going to see provider to provider. So if you were on this call and you are a provider of some sort, this will be great options for you. So these are great options that we got from people like Colleen. Okay. You might see the doctor scripts, right? And you click on those. It's not letting me. There we go. We'll go to provider. I love this high level one. This is one that I really like to use, right? Because I'm in holistic health. That's my jam. I'm a nurse. So when you're looking at an invitation, now remember, you guys don't have to write these down. Don't have to take a screenshot. Don't freak out at me. These are all available directly on your boards, okay? So when you're looking for an invitation at or for someone in this area, and I'm going to go ahead and stop the share so we can chit chat. Get my notes back. There's things that you want to highlight that we have access to that are going to set you apart from the rest of the crowd. Anybody want to be set apart? Yes. When you are looking to talk to a medical professional or any sort of provider, you want to set yourself apart from the competition because they are bombarded on a regular basis for people putting things in their clinics, right? So how are we different? There's 2 ways that we do this. Highlight the product line and highlight the provider program. What does that mean? Highlighting the product line should be something that you already kind of have a guess. Number 1, we use 12 absorption technologies, including liposomes. Most medical professionals have heard of this. It is the same technology utilized in cancer therapy and oncology therapy. It is well known and very high tech. You use the word liposome, they get excited, okay? So use those types of words, those keywords. We have all of our products listed in the physician's desk reference, the PDR. They're going to know what that means. That's going to kind of trigger them. Really? Supplements and a PDR? That's pretty interesting. We are the first to market neurocosmetic. That's also a big keyword. I just did a connect call with a medical professional the other day, and the reason she took the call was because I used the word neurocosmetic first to market in the invitation. She literally said that on the connect call. The only reason I took this call was because it got me intrigued and I had never heard of that, okay? The second way is highlighting the benefits of the provider program. Most of the time when these supplement companies put in their clinics, there's not like a huge support system behind it, right? You have the benefit of saying you do. You literally have however many people, 44 people on this call that are willing and able and want to utilize this program to the betterment of this team. Like teamwork makes the dream work. So you have a team of close to almost 1,000 physicians that we've already attracted. So you can say things in your invite like we are attracting hundreds of physicians and people just like yourself. We also have a turnkey program. This is a really nice little keyword you can use. A turnkey program to help you launch this in your clinic and provide you an additional income source, an additional revenue source. Those are things that they like to hear. This is the best of the best products and I can help you make income in a space where you probably aren't making income right now. Most of these providers have empty walls. Have you ever been in your clinic or your doctor's office and the white walls are staring back at you? That is empty space waiting to be monetized. And if you guys will mute yourself too as we go through. So help them monetize it, help them see the benefit. And then the very last thing you're going to do is you're going to ask. So you have your invite, you're going to invite them, and then you're going to ask, are they open to hearing more? Would you be willing to hear more? Some sort of phrase or terminology like that. You're asking them to take a look at this. I really like using, hey, would you be willing to look at this and give me your feedback? Your expert opinion. Because a lot of these people are experts and they want to feel like their opinion is warranted, right? Okay. Then the next step, we all know how to do this. You're going to set up a time to see the program, see the company, see the products and the program. This is probably going to be done, in my opinion, on a Zoom one-on-one. That is usually your best bet for these types of folks. And I want you to remember the time that you spend is super important because you are investing into this. For example, in some of the providers that are coming on right now, Francoise told me this morning that they're starting with a founders pack and then getting 2 or 3 of the power up packs to take advantage of the product cost, all the benefits. And can you imagine if that type of volume dropped in your account tomorrow because you're willing to spend a one-on-one Zoom with them with your upline? So these are people that you want to spend time with. Remember, they might not build the business. Some of them do, some of them don't. But the product flowing through your organization is super valuable, okay? So connect call, Zoom one-on-one. I like doing a Zoom one-on-one with like me and my person, my team and their person, their prospect, because I can show them on the Zoom all of what I'm showing you today. So that's usually the best bet. I think that's also what Francoise uses a lot, or an in-person event. Some people come in at an in-person event. Now, if you are not the upline leader, a lot of us on this call are the upline leader, and we're going to be utilizing a lot of the leadership roles to help our team do this program. But if you are not, you're going to use your upline leader. So if you're on this call and you're on Dottie's team, you're going to be calling Dottie to help. If you're on my team, you're going to be calling me and Cassie, right? You're going to use those people to help explain the return on investment for these providers. We have documents already created that helps you do that, but it's so much easier to do it as a team, okay? They're going to help answer questions and they're going to help you close, because that's really the big deal. Like, hey, we only have 2 weeks left to power packs. If you want to get involved and you want to utilize this as a growth potential for your business, we need a chat. Like, those are the closing statements that are much easier for your upline leader to say than if you're, just getting started in this business, or you're in this business, but you haven't recruited a lot of these people yet. So that is the recruiting. It is really similar to how we share with everyone else. Okay. Remember, these people put their pants on just like we do, even if they're yoga pants for me today. So we share with them very, very similar. We just highlight some things in a little different way because they want to put this in the retail location. And then the last step is launching. Okay. Now I want to caveat this. Please don't feel that you have to do this alone. You have a team support system that is here. The goal with this program was that only, 1 or 2 people didn't have to launch every single provider on here. Can you imagine having to launch thousands of people? Like, thank God for Francoise. Hallelujah, right? But we needed this program so that we could be support systems for our own teams and for our own resource center. But don't feel that you have to do this alone. If it's your first provider and you're launching your first area, you're probably going to want to call Glenda or Dottie or any of the other, like Mike. Mike has launched several provider areas. Like, these are people that are going to help you tremendously in this process. And then once you do a few, you're going to be like, oh, this is old hat. Like, I'm a professional. I got this. But doing it in the first couple of times, you probably want to have help. So the launching is next. And that really is person dependent. So I'm going to go through the boards. I'm going to share again. Okay. The provider program is the boards that we're going to be looking at. This is kind of your one-stop shop for the program. And I want you to, in the beginning, hang out in this concierge resources section. Okay. This is where it teaches you how to actually be a concierge. We utilize the word concierge because if you've ever worked with providers or any other kind of people, I lost my, hold on. Where'd he go? Okay. I found it. Pause for effect. Okay. I had to see my screen. Couldn't see it anymore. I clicked the wrong button. If you've ever worked with specifically physicians or other types of people, sometimes when they hear the word network marketing, they're like, no. So we want to make sure that we are coming at this in a professional manner, that we are the professional. Think like a pharmaceutical sales rep, right? They may make a ton of commission on whatever they're sharing with that provider at that time, but the provider is much more open because that's the process they've had for a long time. So we are concierge reps. We represent the brand of 3 as we are sharing with these providers, right? And then some providers will choose to do the business because, I mean, why would you get paid one way when you can get paid 8 ways? Oh, sorry, Audrey. I got a text message. Why would you get paid one way when you get paid multiple ways? But some providers don't. They just want to do retail. So we have options for both of those people. The concierge process document is really going to be something you're going to want to look through. I'm not going to go through this individually step by step, but this walks you through how to make those decisions. So once your provider decides, hey, I'm going to start, this is what I'm going to get, you're going to help them figure out where they want to start with, what products they want to start with, how they want to utilize the packs to their benefit, right? And you're going to work through this little box right here that you see. This is provider options. I'm going to show you how to find that where it's a lot bigger, but you're going to figure out what option. Do they want to offer this retail only? Do they want to offer this retail in their office and then also utilize the online sign up? I love this second option because not only do you get the retail benefits where you have product in the clinic that's heading out the door with patients and clients, but you also are having their staff or whomever's working with them in their location sign up those clients for a monthly shipment. Not only do the clients get benefits like 10% off their products, but say you're this is a good one. Say you're an esthetician. You have an esthetician that you're talking with and they do Botox and they only see those clients. I've never had Botox, but you probably only see your Botox lady maybe every 3 to 6 months, right? Somebody drop in the chat if y'all know. I've never had it. I'm a chicken. But if they only see those people every 3 to 6 months and they shared with them Visage, I want you to imagine getting the benefit of sharing Visage once in the clinic and then having that patient sign up for multiple shipments. So every single month, they're going to get an order of Visage. And to give you an idea what that looks like, every time you have a customer order Visage from your business, you're going to make a commission of $33. If it's on SmartShip, it's a 10% reduction. I think it's 29. Don't quote me on that, but I think it's 29. Now imagine this person sees hundreds of clients a month. And imagine just one, like a percentage of that. And they maybe have 100 people every month on SmartShip. Those 100 people are not going to be in the clinic every single month, but every single month, they're going to be making at least $330 from those commissions from, actually it's more than that. That's just 10. So times that by another 0. Sorry, I'm dyslexic as well. So, but that's the benefit of having the second option. Okay. And as you go through this program, this is going to be super helpful. You're going to determine what options they want, what type of inventory they want, what product pack is going to be best for them. You see why you're going to want to use your upline leader at least the first couple of times, because it's a lot of stuff that you want to take into account. You're going to get organized. We have all of the documents to help streamline this process, but you'll want to make sure that you customize those. I'm going to go through them in a little bit, but there's going to be customization. You're going to brand for that location. You're going to utilize their link to create online options for people so that they can scan and order directly in the location. You'll also help with display. And Francoise has done an amazing job, and I'll show you in a second, of having all of the display options ready to go. So you literally open it up, you can show the provider what type of look they're going for, and you can order all of those things directly. They can either reimburse you or however y'all want to work that out. It literally walks this through. It walks you through staff training so that the staff is actually helping hand the products out, take the payment, handhold the patients and or clients, walk them through the online sign up. And then there's some other things. So this is kind of like your holy grail. I'm going to really recommend, if this is something that you want to utilize in your business, this program, if you have a large, like if you're a Cassie or a Julie who are nurses on this call and you know a lot of providers, then you're going to want to look at this and kind of go through detailed. I just don't have the time, we don't have time to go through line by line, but this is a super helpful thing. Location branding checklist is going to walk you through. We recommend having a binder for yourself that is an example to use in your recruiting. And we also recommend that you create a binder for every single location with customized documents. This is going to help you train them. You literally have it step by step. Okay. And then it's also going to walk you through having displays. So this is super helpful when you're getting ready to launch somebody. There's little check marks. You can print this and you can put this at the top of your binder and say, I've got this, I got this, I got this. I customize this. I'm good here. Now, this should be very helpful, I hope, especially for the ladies that were chatting in the very beginning on Dottie's team that went and had to print everything individually. When you click on the folder, Create TPP Binder, this is your binder, your example. It will help you a ton to be able to print this and have it on paper. Anybody else a visual person? Because I am. Not only do you have a cover, this editable template, when you see the words editable in this program, it means that it is a template on Canva that you can click on. So I'm going to click on it here. It has the link. It's going to take me directly to Canva. And it's going to give me the option to use a template for a new design. This is the button that you must click every time because you want to put your name and your phone number here when you're handing this binder to Dr. Smith and his team, right? They need to have a way to contact you. So this is how you're going to use those templates. We're going to go ahead and go back. So every time you see editable, self-explanatory, it's editable. And so you'll be able to make a copy and save that in your Canva, as well as I would suggest making a board. If you have the paid version of boards, if you're going to be launching multiple locations, I'm going to highly recommend use the commission that you get from that first sale and upgrade your boards to the paid version. I think it's $100 for a year. It will save you because you can create your own boards and have your own, God bless, it keeps timing out on me. You can have your own boards with your own invites. It makes it just so much easier. You can have all of your options, and each of your providers, you can have a specific boards for them. So this is also how you'll get your checklist for your resource binders. There's different sections. It walks you through how to do that. And then the last link that I want you guys to see here is the TPP example binder. This Google Drive, if you click on it, will take you to every single document that we have created in the same format it is in boards. So instead of going through each section in boards, you can click on the About Us. You can easily print the welcome letter and the mission statement to add to your binder. And because it's a Google Drive, you can download the entire folder all at once. So hallelujah, thank you, Google. You can go through and look at, for example, system implementation. If your provider is wanting to do retail only, there's a process flow sheet, all of these things, okay? I want to show you really quick if they're going to do things like online. If you see the word, so this welcome letter, for example, says must brand. Let me see if I can show you the title. It's not letting me on my phone. Okay, do y'all see the words must brand? This should key you into knowing that this is a template. So you have an editable template, and I'll show you how to get those all in one-stop shop. So this is going to be super helpful. Please bookmark this link. As you're going through everything, you're going to want to check into this one, okay? So everybody understand where to get that. And if you need to, Dottie, you can drop this and share this specific one, but it's under concierge resources. You're going to spend a lot of time in concierge resources, okay? Remember we talked about templates. This folder where it says customized documents. What do y'all think that is? It's to customize documents for your provider location, okay? Once you click on that, there is a Google Doc that you can click on. You can click on the link, and it is going to take you to a document with the link to every single possible Canva template. So if you are launching Dr. Smith, and Dr. Smith does injections, and he wants to do whatever, right? Like you can go through this, you can click on all of those things. He wants to do home orders. He wants to allow his patients to order online, but also allow his patients to order in the clinic. You can go through all of these things. You have the ability to brand for that provider. All you need to do this is their logo and their information. Things like, for example, let me show you the product recommendation order form. We're going to click on that. We'll go to Canva. It should pop up. We're going to use this template for a new design. It's going to automatically make a copy slowly. Now, obviously, you're going to want to change provider name. We're going to change that to Dr. Smith. We're going to put in his details. We're going to put in his address. This little box right here, you'll want to delete it and put in their logo. Okay, you can upload. We're going to use Cassie's picture as the logo because it's the first one I have. And maybe that's the logo, right? You'll resize it. Do you see what I'm saying? So these templates are essentially done for you. And we'll put that back. You just fill in the stuff that makes the most sense, right? Like the patient's name, you're not going to know that. That's a place for a sticker if they have a patient. But this is specifically to help you. Every single template has been created to help you, give you everything that they could possibly need. Now, there will probably be some holes as we work through the program, but they have been utilizing this program since May to launch multiple locations swimmingly. So these are all of the things that you're going to need to edit. They're all in one spot. Back to boards. So like I said, concierge resources is going to be a really big place where you'll want to sit, okay? When you're using your binder to share with providers, I also recommend using boards, showing them how easy it is. It's on my keyboard on my phone. I can send you all the things, so you can utilize all the things, and they'll have access to their own boards. So I'm going to go through the program really quickly and kind of show you what the different options are. So About Us is going to have a detailed welcome letter and mission statement. This is for the provider to welcome them to the program. There's also videos that you can send. One that Daniel PQ did directly, as well as Dr. Dan did directly, specifically for this program, welcoming them to this program. So you can actually use that prior to launching them. You can send them a welcome to the program as they start their journey with 3. And then when you have another conversation with them, just like we would have a launch, like a, what are they called? I drew a blank. Somebody drop in the chat. What is it called when you first launch a brand ambassador? A planning session. I got it. When you schedule a planning session, thank you, Kathy. This is the same thing. You're going to schedule a launch chat with your providers. You're going to go through program options. This is the document that I was mentioning to you guys. This helps them see what the potential return on investment is. So if they order a foundation pack, you can go through and look at the ROI folder under Founders Pack. This has been updated to add the new Visage and all of the benefits. If they sold every single product in this package at retail, based on the discount that the package has, they will make 38% additionally on top of the cost, right? This does not take into account tax and shipping because that is different in every location. But this is a general idea that, hey, if I buy a foundation pack and I sell all of those products in my location, I'm going to make an additional $1,000. Now, caveat, most companies that share supplementation with provider clinics, locations, retail locations, their general commission is anywhere from 25 to 30%. Are we competitive? Even with the Founder Pack, we are super competitive, okay? So I want you to put that in the back of your mind. We have competitive return on investment for these providers to put in their locations. There's also one for the Business Builder Pack. So for example, if the provider comes in, I always recommend the Founders Pack because this does not take into account the almost a year worth of Smart Ship. So their business is paid for and earning them money for an entire year on one Founders Pack. We agree? That's huge. So not only do they make additional income from those products if they sell them retail, they're not having to pay out of pocket for that account, that main account directly. Now, say they want to buy more, they want to get a power pack especially. They might want to order those things under a new account, and they might want to utilize the Business Builder Pack. Maybe they need different levels of products or less. Either way, both of those packages are broken down so that you can see the ratio of how much they would make versus how much it would cost. Okay, so that's program options. This is something you'll sit down with them when they're actually getting ready to start. How do you want to utilize this in your business? The program options are 3. Since we have a super streamlined customer approach, there's 3 options. They can sell the products in-house retail only. That means only selling individual products in their location. The return on investment is anywhere from 25 to 50%, and they can pick however much they want to charge, right? We have a pricing list, it's editable. They can change the pricing. So their return on investment is literally whatever they want it to be. If they are, for example, in Tampa with Danielle and the Visage they can get online for $159, Tampa's a pretty hot topic place. Maybe, just maybe, they're selling it for $165. If you increase every single product 10%, guess what? You make 10% more return on investment. We all agree? Is the mathing? Nodding heads. Okay. The second option is in-house retail plus online sign up. And what that means is not only are they going to have products in-house that they're going to retail, the staff is also going to sign them up for online, either Smart Ship or online products. Again, remember, this is changeable, it's editable, it's cancelable. This is not a contract signed in blood. They can change it at any time. They can add products, delete products, whatever they want to do. But when they utilize this as well, they're also adding the residual income part, which is why we're all here, right? The third option is online only. I'll give you an example. I have a provider who is telehealth. They do online patients. That's all they do. She does not have a retail location. So for her online patients, she is going to sign them up online, right? And it also includes the additional client benefits, which are 10% off the discount if they sign up for Smart Ship, both initial order and subsequent orders. They get a $33 reward certificate for every $300 spent cumulatively. And they also get a $10 reward certificate for anyone that orders that they refer. So there's a lot of customer benefits if they're doing simply online. And again, the retail price online, the return on investment ranges from 20 to 25% per product. Okay. So that helps you kind of show them the different options. The next step is, how do we implement? We figured out what they want to do. Now, how do we put it in the clinic or in the location? System implementation is your third step, and it is broken down by the process they are utilizing. Okay. So if they're going to do only retail, you're going to click the retail sales process. If they're going to do in-house client sign up, you're going to click that one. If they're going to do both, the second option, you're going to use both of those processes. And if they're only using online where their clients sign themselves up, they're going to use client online sign up process. Does that make sense? Is that fairly clear? All right, clear as mud, right? Just kidding. So in-house client or in-house retail sales. Each of these processes has a flow sheet where it starts you from start to finish of how to actually utilize this and what the staff should do. So having this in a binder that you guys have printed for the staff, when you go to the location, do you see how helpful that is? Because you can literally walk them through. Client has an appointment. Provider recommends 3 products. The provider fills out the product order form. The form is taken to the staff. Is the product in inventory? Yes, it is. So we're going to give the product to the patient. We're going to give them some handouts. The patient's going to pay for the product. And then we're going to see, do they want a monthly order? Is that something we're doing? And if they do, we're going to follow the in-house client or the in-house online process right here, client sign-up process. And here is that flow sheet. So it's going to walk you step by step by step. So if once the staff sells that individual product and they want to sign them up online, they're going to pull up the provider's link. The link is directly available. They're going to pick whichever products. They're going to create an account for the client with a username and password that we suggest. They're going to complete all the details, all the billing, all the things, and then they're going to place their order so that on a monthly basis, they're getting that shipment. So this process flow sheet is super, super helpful when you're actually launching the location. And then you're going to go through here. This is a front desk sales guide specifically for retail sales. There's also one specific for online. Okay, so you have both options. Forms and documents. These are going to be things that you're going to want to edit and change. Again, the provider program, the provider product recommendation form is there. This is where the provider can simply say like, hey, I want them on Visage. Maybe they're an esthetician. Sign them up for Visage monthly, okay? The pricing list, I wanna show you this one. This is what that looks like. We give them the online customer price. They can offer it for more. This is also an editable link. Remember what editable means? It's editable. So you can go in as a template and change this specific for the location. So if you want to increase the prices to everything by $10, you're going to increase the provider's return on investment significantly. For example, if you're in a rural area, you may want to keep the prices as is. If you're in an area, say Jacksonville, which is a huge bustling metropolis, you might want to increase the prices. So it's very dependent on the location, okay? Under client handouts, we kind of tried to keep this as small as possible. There are 4 options for client handouts. They include a welcome letter. I'll give you this example where the provider can put their logo, they can put their direct clinic number, they can put their name. So this is also an editable link. There is a product guide, and Dottie did an amazing job helping create this because putting 7 products evenly on a form is woof. So this is a product guide. It goes through features, benefits. It is specific to our team. It is not something you're going to be able to find outside of this program. So if you're looking for things in the program, make sure you're looking in boards, okay? Because that's where they are. It goes through every product. It has Dr. Dan's videos. It has all of those things. There's also a symptom guide. We've updated this to include Visage. So this is also able to be done front and back to save on printing. So you can simply, if the patient comes up or the client comes up, the front desk can say, hey, what are those products over there? They can say, hey, here's the information on what they are. There's also under the online sign up, there's a way that they can sign themselves up at home. All of these are editable, and you'll see up here, double-sided options. You can print these double-sided. They're also editable double-sided. So if you want them double-sided, make sure you always click double-sided. if you want, and this is very clear in the link for the Google Drive to actually print them and edit them. So you don't have to go through each of these steps to get these documents. I just want you to see the steps so it makes sense where they go and how they fit together, like a great big puzzle piece. Okay. Product inventory is going to be big. This is going to help. It's a staff sign-off sheet. It's going to help staff know when they need to order products, because one of our instructions when we sit down with these provider locations is when you get low, I need to know within 1 to 2 weeks so that A, shipping time, and B, we can help get them the best return on investment. Let me ask you a question. If they order their products directly from their account, just individually, will they make extra commission on those products? No, because they're ordering it under their account. So our instructions usually as concierge is to how to help them get the most bang for their buck. Okay. So for example, if they need a whole bunch of every single product, we might recommend, if you sign up your clinic, if you sign up another spot, you're not only going to get the benefit of the bulk discount that's available in those packages, but you're also going to get the benefit of commission. Who wants to drop in the chat how much commission is on a founder's pack? Everybody knows that one, right? So what does that do to the return on investment for a provider when you can increase the money that they make by $350? Not even including if it helps them cycle. So there's really specific that they help us help them by keeping track of inventory. And this is the form to help them do that. We also have a Venmo PayPal display. So if they have their own location, this is really helpful for hair salons and the esthetician offices and those types of locations, because they do a lot via Venmo. If Stephanie Stewart's on, Stephanie, I bet, is using this all the time, because under her product display, if she's telling a client while she's doing her hair, hey, I just got introduced to this new neurocosmetic, I think it's going to help you. Or say she's doing her hair and she's like, man, you really should be on my collagen. It'll help your hair grow. You're wanting thicker, lusher hair. This is going to help you. And the patient and the client's like, yes, how do I get it? Stop by the display on the way out, grab a box, pay me on my Venmo, QR code. Everyone has utilized these QR codes to pay Venmo, PayPal, things like that. So we tried to make it as easy as possible. So that is the retail sales process. The biggest difference with the online process is going to be the front desk guide. It's going to have the customer option, because the customer option online is not something, if they wanted to do retail only, this is predominantly the main thing that we get is they want to do retail plus online. So get real familiar with those two processes because they mesh together. Okay, so you'll want to use this front desk guide. It basically walks them through how the client can sign up online. And the only different in forms and documents is there is a client order form. This is also editable. So for example, if they're really busy and they can't sign them up right away, do they let that person walk out the door and be like, I hope you sign up? No, we have a downtime form where they can get the patient or the client's information right away. They can tell them exactly what products they want. Do they want to do a monthly auto shipment for all the benefits? Do they want to just do a retail customer? It is a downtime form. It also has an editable link. As you guys can see, client order form, editable link. The other thing that is different is under the client handouts. The only different page is how to order at home. Because if for whatever reason, the client says, hey, I'm really busy, I got another appointment, I gotta run, you can hand this document to them with the provider's QR code direct link, and it walks them through how to order the products at home. It also gives them immediate information on the benefits of being a customer, okay? This is also an editable document. There is also the ability to do double-sided. We suggest having a double-sided welcome letter on the back, how to order, and a product guide on the back, symptom guide. So they are both options for double-sided, so you save paper and print, and it saves you time and look and all the space. And they're editable. Okay. The other difference in the online sign up is QR code instructions. So if you are not familiar of how to get the QR code, there are instructions here that Mike has so graciously helped us, and he will be updating these videos so that they're clear and how to actually get the QR code. The simplest answer is you're going to grab the marketing site from your back office. So the provider's back office you'll want access to. You're going to grab the customer site. Has everyone seen the new customer site? If you haven't, I suggest you go look at it for yourselves. Drop the customer site if you can, Dottie, for me, like just drop yours so they can see what it looks like. These instructions also tell you how to get that. If you don't have access to the provider's back office, it tells you how to get their details. Okay. You're going to copy the link. You're going to put it into a QR code generator. There are plenty online. This is the one that we suggest. You're going to save the QR code in as a file on your computer. And then you go to, say, for example, the forms and documents. Say we're going to go to the client order form. It's a bad example because it doesn't have a logo. We're going to go to this one and we're going to go to how to order. You can easily, you're going to delete that little box, put the logo or the QR code right there. Okay. Remember, as I go through this, guys, don't get overwhelmed. We are here to help. I know there's a lot of documents, but there's a lot of steps. And the fact that we have done this for you is so exciting that once you do it once or twice, it's going to be amazing. Even like drop it in the chat. Lisa Brandon just had to go through all of these documents the other day. And once she did it, she was like, this is great, right? The online sign-up process is almost identical. The only difference is that it doesn't go through all the other steps because it is specific for people that are doing only online. They might not have staff in place. They might just be doing telehealth like my friend who's the other provider I was telling you about. This is also great for people that want to have like an email list. You have providers that maybe do social media type things where they give out a lot of education and they have an email list. This is something that can be very easy to utilize in place of a actual retail location. Okay, so that's step 3. Let me tell you, once you get through step 3, the rest is like so doable. Step 4 is going to be your product displays and supplies. This is the part that I was telling you that you pick which example that you want it to look like. You can go through this with the provider. Do you want glass shelves? Do you want white shelves with gold accent? And each of these has all of the, there we go, all of the things that you see in the picture able to be ordered directly. Guys, you have no idea how nice this is. Huge shout out to Francoise for putting this together and having so many options. So there's white shelves with gold accents, white shelves with wood accents, whatever it is that fits with the aesthetics of that location, they are directly there. There's also a place where they can get banners. Say they want to get a banner, they want to get a table banner, things like that. They can get gear to order. There's also a place for wall displays where you can use exactly what they're using in all the other locations. Guys, y'all want your provider's office looking like Dr. Schneider's? Yeah, you can, because it's right here. It's literally the exact same. There's also some Dollar Tree items that are super, much more reasonably priced, like the cute plants and the little, what's the word, mirror things. It's just to make it look beautiful. How many times have you gone to a provider's place and there's like one little supplement on the counter and no, we want to look professional and clean and desirable, right? We all agree? So that is that section. Number 5 is going to be branding and displays. This is basically the same stuff that you already went through. It's all the documents in one location. There's also printable displays. So for example, if they want to have, I love this new product launch one, it's super cute. If they want to have this in a nice little picture frame and they want to have their QR code, say a client comes in and they get their hair done, or they went and got, you know, their chiropractic appointment, and they don't talk about 3 because the provider's busy, but they see it on the way out, they can learn more directly there. And you can print those, you can edit those. We have all different kinds of options there. Product inventory is the same. The staff resources is the same. It's just different locations of things. We put stuff in multiple locations. So if you can't find it in one, sometimes it's in another. Different banners that you can print out. There's all kinds of really pretty photos and things. And as we go through and as we launch more locations, there will be more things added. Number 6 is going to be staff training. This also is already in the system implementation, but it also has a section for product training, because what if the staff wants to get involved themselves? This is a nice area where you can say, hey, I'm going to send you this whole document list. You can look at all the products, you can look at all the clinical studies. That way, if they're getting a lot of questions and they're like, I don't know what to tell all these clients, you can help them learn more, and potentially they can get started with 3 as well. The Shed 5 that you see in this area, but also it is, I want to show you real quick, it is down here. This is an optional program for gyms, or if somebody has like a weight loss clinic. There is a wonderful program where it's basically Shed 5 and 5, and it's directly linked with helping the gut through the products that we have. There is front desk information, all of the details here. There's testimonies that you can already see. There's before and after pictures that you can see of this program. So there's there's package bundles. So there's 6 products, so they can get the 4 product. How they do that, you can see this. So this is not going to involve the new product, obviously. It's not going to have Visage information in it, but this is specific for, say, a gym or a weight loss clinic that wants to help. Like, how many of y'all have seen these new GLP-1 shots? Like, they're everywhere. These type of people can utilize this in their locations as well as the GLP-1, because the main thing that you want to be making sure of with those types of people that are on these shots is what? That they're on a good multivitamin, that they have a good amino acids because of the protein content, right? Like, we have all of those things to help support those people in that process. So this is a great optional program. And if you are looking, if you have gym owners in the back of your head, if you're looking for those people, that is going to help you. Order and reorder. It literally is what it is. This is going to help you order and reorder for providers. It's going to go through how they want to order things, how they want to change things up. This is a real specific process that you want to work with your upline to give them the best return on investment. Remember, we talked about if they just straight order it, it will not give them the best return. Recruiting resources. This is a super helpful location for what do I send a provider? So we have a leadership call. Like, do I want to send them information on Daniel PQ? Do I want to send them information on Dr. Dan? We have all the details of our science, the core pillars, all the details of our clinical studies that you can send. We also have all of the details of the products. Maybe I want to send them information specific on Vitality, right? Maybe they're an esthetician and I want to send them specific information on Visage. So we'll have the Visage videos in here, okay? So there's all different things. There's also product testimonies. We have befores and afters, so you can see like these different ones on Eternal, on the healing. Maybe they do a lot of surgeries. This is a surgery, a surgeon. This is a product that if I was going to a surgeon, I'd want to know they had Eternal on the shelf, right? We talk about collagen. These are some great befores and afters. If you see your picture, shout out of collagen and the results from collagen. Okay. So there's lots of resources in this section to help you share with a provider in the hopes of having them join our team. Okay. Once they've onboarded, once they've ordered, this is super helpful section. How do you get them connected? Here's the back office link. Here's all the boards information. Here's a how-to for boards. You see, it's going to be really similar to our onboarding that's already in the 3 info boards. Y'all see that? It's just provider specific. So for example, this is a provider enrollment checklist. So when you sign them up, we want to make sure that they get put in the right places. There's a specific provider UCrew page. There's a specific provider WhatsApp group. So these are those things. Okay. And there's a support text. They get a diamond text. We just called it a provider support text. It's the same thing. Okay. And then the last is videos. There's a few different videos. There's some tutorial videos. We put them all in one place. If you need some help, there's product videos here. And that is the provider program in a nutshell. I will tell you guys, when you first get started in the program, don't get overwhelmed. This is step by step as it gets. And once you kind of think about how actually you would launch a product in a location, it really does flow well. It's just the doing of it at the beginning. So I want you to know where things are and know that there is a huge support system here. Guys, this is not one or two people working on this. Was a massive undertaking. And I think that it sets this team directly apart from any other team in our organization, because no one else has access to this. So the fact that we took this under and did it so that it would make this so much easier, so we could put this into providers, clinics, and offices, and like, it's huge. You know, people that this will directly impact. And I want you to imagine if those people get started and they order 2-3 of those massive pro packs, what that, like, 2 or 3 providers with the level of what they come in at can help you earn the trip. So I don't want this to look like this is work. Like, you're going to have to work to share with people. You're going to have, I mean, like, Linda can hop on here. Her husband's a provider, so she has great insight. They get hit up a lot. So remember, we have the best. We know that this is the best product line out there. We just have to showcase it in a way that is professional. And I think this program really helps you do that.